Funding for Election 2020 coverage is provided in part by AARP, a nonprofit, nonpartisan membership association, 86,000 strong in North Dakota. AARP encourages you to vote absentee or vote safely in person and make your voice heard. And by the members of Prairie Public.
Good evening and welcome to Prairie Public's and AARP's continuing coverage of the 2020 election. I'm Dave Thompson. Thanks for joining us. Tonight we have the governor's debate. And here are our candidates from left to right. First, Shelley Lenz. She's the Democrat. Then we have our Libertarian, Dwayne Hendrickson. And Doug Burgum, our Republican. Numbers were drawn, and after the numbers were drawn, the opening comments go to Doug Burgum first.
Thank you, Dave, and thank you, Prairie Public and AARP for hosting these debates. On behalf of Lieutenant Governor Brent Sanford, First Lady Catherine Helgus, and myself, we are so grateful every day to serve the citizens of the state we so deeply love. As we move forward through this truly historic time, we are inspired by the spirit that all North Dakotans have shown, from frontline healthcare workers to school teachers to parents, farmers, ranchers, energy workers, small business owners, and of course the dedicated team members of Team ND. Over the past 4 years, we've had an incredible string of accomplishments, reinventing state government, strengthening our economy, and balancing the budget without raising taxes. Under our leadership, the state has saved record amounts for the future and strategically invested in the present. We believe in the power of the private sector. We believe that innovation beats regulation. We believe that love, empathy, and compassion of individuals and communities is stronger than government. And we believe in North Dakotans. They're rising to the challenge, and working together, I'm confident, will emerge stronger than ever.
All right, thank you. Next, we have Democrat Shelley Lenz.
Thank you to our organizers for this important public debate. I'm Dr. Shelley Lenz, and like many of you, I voted for Doug Burgum 4 years ago, but I'm here now to replace him because even before the pandemic, he wasn't getting the job done. I'm a veterinarian, a small business owner, and founder of an international nonprofit. I live in Killdeer on homesteaded land in a straw bale house I made with my own hands. I am the great-granddaughter of the original Nonpartisan League, and my platform of homegrown prosperity reflects those values with nonpartisan, practical approach to bring resilience to our communities and our economies as we evolve our energy and ag sector into the future.
Thank you very much. Now Dwayne Hendrickson.
Hello, thanks everyone for tuning into this most important debate for the governor of North Dakota. Thanks to Prairie Public TV and ARP for sponsoring these debates, and thanks to Dave Thompson for being our moderator. Hello, I'm Dwayne Hendrickson, Libertarian endorsed candidate for governor of North Dakota. I'm married to my wife Joanne for 41 years. We have 4 boys, we have 12 grandkids. I'm a veteran. I was on the ballot for governor of North Dakota in 2008 in the general election, and I was a candidate for U.S. House from 2010 to 2018. I've been there fighting for our kids and grandkids for that long. I am a pro-life candidate. I'm a strong believer in our Second Amendment rights. The only red flag legislation I will sign is that which bans red flag legislation. Okay, my goals for governor: abolish your property taxes. Time for you to own your own home. To expunge all low-level, nonviolent marijuana crimes.
That was 1 minute. Thank you very much.
You bet.
All right, our first question then goes to Shelley Lenz first. The state's response to COVID-19 has become a defining issue of 2020. COVID cases are rising, and they're rising all over the country. And there is continued discussions of mask mandates, social distancing, limits on capacities, hand washing, and other efforts. In your opinion, has North Dakota been doing the right things to help prevent the spread of COVID-19?
The facts speak for themselves. We have 422 North Dakotans lost, 258 of those in the long-term care facility. 32,000 jobs lost. 3 health directors quit in 3 months. Hospital capacity has been reached, and the inability to contract trace is present now. It's October, and there's still no plan. Pleading with the public while dismissing your public health officials is not getting the job done. Instead of a patchwork of political talking points, I presented a comprehensive, nonpartisan plan that brings us together, the co-equal branches of government, alongside the five tribes, to ensure a non-politicized unity of response that provides resources and accurate data to our local governments, which can move forward together out of this crisis.
All right, Dwayne Hendrickson is next.
My parents, one lives in South Dakota, one lives in North Dakota. I'm very concerned about the health and welfare of our elderly, with North Dakota and South Dakota being the 2 top hotspots for the coronavirus in our nation. We're going to have to take some drastic action, but yet we're going to have to make sure that we do not take away constitutional rights from our citizens. That's the most important part of this whole equation, is our constitutional rights. Local control over wearing masks and everything is what should be done. As governor, we don't have the Constitution does not allow us to cost you your job, cost you your home, cost you maybe your life because of depression, isolation that makes you take your life, say. And so we need to expedite the solution for this as quickly as possible, and so that our families are safe and that we can get back to the normal life that we all did live.
All right. And Doug Burgum, your turn.
Well, we are in unprecedented times, and here in North Dakota we have had a comprehensive strategy. With our Vulnerable Population Protection Plan, has been heralded nationwide as one of the very best in the country in terms of, we have been doing testing of both healthcare workers and residents in long-term care every week since last spring. Some other states haven't even been able to start this yet. This has allowed us to help protect those vulnerable populations. Our testing itself, we've scaled our state health lab more than any other state in the country. We are doing more testing per capita than any other state in the country. This is why we end up on, as part of a national narrative, of having the most number of positive tests per capita, but it's because we're doing the most testing. Doing a lot of testing is critical when you've got a virus which can live in people and they have no symptoms. Without testing, people won't know whether they have it or not. And this is, again, part of how we're protecting our most vulnerable. Our K-12 restart plan, also part of the comprehensive strategy. Our higher education plan, also part of the comprehensive strategy, run through our unified command, led by Tammy Miller and General Dorman, our Adjutant General and Head of Emergency Services for North Dakota.
Okay. For rebuttal, Shelley.
The facts speak for themselves. We have 422 North Dakotans lost. 258 of those are in our long-term care facilities. We have gone through 3 health directors. Our hospital capacity has been reached, and we now are in a place that we can't even contract trace. It is the end of October, and there is still no plan.
Mr. Hendrickson, would you like to rebut?
One concern that I do have is the mask wearing of our young children in classes, and when you hear reports of nobody being able to say what kind of medical problems our young kids may endure during their life because of this COVID, is something that I believe every parent should be concerned about.
All right, and Doug Burgum, you have one more shot.
Well, I'm pleased that in North Dakota we have one of the lowest fatality rates in the country compared to all other states. And each death we have in North Dakota is a tragedy. And of course, across the country, the brunt of the deaths have occurred in long-term care in every state. But in terms of where we are relative to helping to save and preserve lives, relative to the actual run rate of deaths in North Dakota. This summer with the Vulnerable Protection Plan, there was fewer people dying in North Dakota from all causes this summer than there were in a typical summer. So we continue to fight the battle every day, and we congratulate and say thank you to all the people on the front lines working particularly with those elderly and most vulnerable populations.
This next question we begin with Dwayne Hendrickson, and this follows up on the subject. Mayors of Fargo and Minot have issued mask mandates, albeit without enforcement. Bismarck and Grand Forks mayors have said they will not. Should the state issue mandates with enforcement provisions?
No, they shouldn't. And I happen to be a resident of Minot, and I was disappointed that Sean Sipman did that and the city council. I realize where they're coming from, because at some point in time, somebody's going to have to really take control if these deaths continue to mount and the disease continues to expand. There's going to have to be a solution, and dang quick.
Right. Doug Burgum?
Well, we support masks as when unable to socially distance, because we're trying to slow the spread of a very contagious and, for elderly and vulnerable populations, a deadly disease. But when we think about individual responsibility is the right way to approach this, because there is not any way that a state can enforce a mask mandate. There are many states that have mask mandates that have higher % positives than we do right now. They've got record cases right now. And so while we believe that masks work when used appropriately and when people can't socially distance, we're less confident about mask mandates. We do support those cities and localities, and whether it's a K-12 school district, a higher education institution, city buildings, or a business that wants to protect their own employees and keep their workforce safe, or make sure their customers are comfortable, we support those that are doing it as one arrow in the quiver of a mitigation strategy to try to slow the spread of this contagious virus.
And Shelley Lenz.
The facts speak for themselves. We have reached hospital capacity, and we are unable to contact trace. Our response is not working. Mandated masks have been enforced in many states that have slowed the spread and actually have turned to green. We need mandated masks, but it's only a tool. We need that in connection with an overall strategy and plan. So that's why I came up with the COVID Crisis Management Plan, which puts in the structure to help our local communities make sure they have the resources and the correct information to help them enforce the mask mandate, as well as make sure they have the tools to increase social distancing capacity so we can all get back into a relatively regular way of life again.
Dwayne Hendrickson, would you like another bite at the apple on this one?
I'll pass on this one.
Okay. Governor Burgum.
Yes, contact tracing is another leg of the stool. In North Dakota, we've gone from less than 10 people doing contact tracing to now over 400. Plus, we've mobilized National Guard members to assist in this effort. And we have been able to continue this long after other states had to give up, because many states got overwhelmed by cases and were unable to continue contact tracing. And we've had a temporary blip this past weekend with an increase, but with the shift in resources, we're confident that we can continue to contact trace. We also are asking the citizens and population, if you test positive, out of consideration for all those who have been around you, of course you should let people know and identify other people. So again, if you've tested positive, let your close contacts know your result, and you'll be doing your part to help slow the spread.
All right, Shelley Lenz.
Again, the facts speak for themselves. We are unable to do proper contact tracing. Viruses spread exponentially. There is no evidence that this is going to slow down. And the testing that we're doing is showing that we're not testing enough, and our response is not adequate.
The next question goes first to Doug Burgum. State has received a lot of money in federal COVID relief dollars. $1.25 billion of that has to be spent by the end of the year. Has the state spent the money responsibly? And if not, where should the money be spent?
Well, working with the legislature through the Emergency Commission and through the budget section, there's been incredible collaboration during this past year. And I feel very good about where the dollars have been placed. When we take a look at how much is spent on supporting individuals and businesses, it's almost 2/3 of the total dollar amount of that $1.25 billion. The others have gone to support healthcare and education, both K-12 and higher education. It's gone to support value-added agriculture and value-added energy in our state. So again, when we're fighting a virus which is going to be gone at some point in the future, we have to make sure that we as a state are in the best position to manage that. And I'm very, very confident about how the dollars have been spent and very appreciative of the collaboration with the legislative leadership as we've moved through this.
Shelley Lenz, your response?
If the governor had invited a full legislature to discuss this and/or listen to the people like I have for the last 7 months, what he might have realized is that instead of plugging holes in oil fields, we should be plugging holes in families' budgets. Child care, health care, paid family leave, extension of unemployment benefits. And that's what I will prioritize with the CARES money, and supplemented with state monies as I lead this state through its economic crisis and health crisis.
For Dwayne Hendrickson.
First of all, I'd like to know how much of that $1.25 billion is going to be spent on mental health. We're going to run into a very large mental health crisis very quickly this winter. We're going to run into short days, isolation, people that are losing their job or losing hours at their job, maybe losing their business, maybe losing their life savings, and go into a state of depression. We're going to need mental health services very much. But we have to bring new industry and jobs to North Dakota. We have to take advantage of this thing that is COVID, a bad thing, but we have to make positive gains from this bad virus. And that will include opening new businesses, opening new technology businesses that can serve people from different locations in the whole world. You know, say we're going to have a major industries moving in, like we have Amazon moving into Fargo and Sioux Falls, making it easier for people to order and get their orders quicker. And there will be a big upturn in businesses like this that will make life easier for Americans. People won't have to go out into the open if they have problems with their health that would make COVID maybe a death sentence for them. So all of these new industries that we're going to create will be a positive for North Dakota, and we will come out of this stronger than before.
Doug Burgum, second shot.
Well, I agree with Dwayne. Mental and behavioral health is a key issue anytime, even before the pandemic. And that's why at every single one of our over 75 press briefings, we've included a section updating the public on what we're doing on mental and behavioral health. Separate from the $1.25 billion, our fantastic behavioral health team has won numerous grants from the federal government to help with this. And of course, we continue to push hard against the disease of addiction. On the unemployment front, we put over $400 million of that $1.25 billion into the employment fund. Some of that is going to be turned back before the end of the year because we're on track right now because we've kept our economy open, we've kept people working. We were successful through the Bank of North Dakota in helping to deliver $1.9 billion of payroll protection plan to over 19,000 North Dakota businesses. That took pressure off of unemployment, and we'll finish the year with our unemployment fund higher than when we started. And that's going to allow us to not raise any unemployment insurance taxes on businesses. So we've been fighting for businesses every day. And as far as the oil field, the work that we're doing there to reclaim abandoned oil wells from companies that went broke in North Dakota in the 50s or the 80s, that helped preserve over 1,000 workforce jobs. It's going to help us get our energy sector back going again. And it is, and of course, the energy sector drives over 50% of the taxes for North Dakota. So every dollar spent there is going to drive more money for the state budget, which helps everything, education, healthcare, and infrastructure.
Shelley Lenz, one more shot.
The fact that the economic crisis, coupled with the isolation due to the failed COVID response, will make these diseases of despair worse. We need a plan that will battle these diseases of despair, a COVID plan, so that we can do temporary expansions of capacities, so we can have safe social interactions in our towns, our schools, our churches. That's investment into community health, and that is how we will help battle this diseases of despair with a full, comprehensive COVID response plan.
Dwayne Hendrickson here.
We have many areas of concern in this COVID response. Some of it's going to be linked to education of our kids. Some of it's going to be linked to our oil industry that on March 1st, prices of oil went down to zero. That caused a major problem for North Dakota, and then COVID on top of that with people losing their jobs and losing their income. So we're going to have to come up with many different ways to help our citizens, to help our businesses, and to help our state, because like I say, we're going to run into a situation where we might not ever be able to take control of this. And so we're going to have to work on it very, very hard.
All right, our next question is for Shelley Lenz. This is from our partners at AARP. With new pathways being made available from the federal government, would you pursue efforts to allow North Dakota to import prescription medication on a wholesale basis from Canada or other countries that have similar safety and quality standards?
Safe importation of prescription drugs from Canada is a worthwhile avenue to explore, but there is some devil in the details there, and we need to make sure Canada is willing to negotiate with us. In the meantime, what we do need to do is lower prescription costs. I can sell 3 weeks of vitamin K for a rat poison dog for $20. If I write that prescription to a human pharmacy, it is $800. The difference between the veterinary clinic and the pharmacist is the multi-billion-dollar middleman. That entity needs to be transparently assessed and made sure that we are getting the best prices for our citizens.
Right. Dwayne Hendrickson.
Medical prescriptions are getting very costly. I believe those are occurring, I believe that is occurring because of our politicians in Washington, D.C. and Big Pharma. So we have to change the way that pricing for our medical drugs is given, because how many people can afford tomorrow to go and pay $1,000 for medication for a week? You know, I can't, and I don't even know very many people that can, but we have diseases now that take pills that are $100 a piece or $200 a piece, and I can't see how people can afford to live and still pay all of their debts and have this medicine to stay alive. We have to make things more streamlined and cheaper for every citizen of our nation.
Doug Burgum.
Well, this is one I agree with on Shelley. Certainly we want to do everything we can to participate in a global market for the very best drugs at the lowest prices for American citizens, but saw a presentation last year that included all kinds of drugs that looked exactly perfect in terms of their labeling, how they were manufactured. They were manufactured in India or China. They were sent to Canada, and then they were available on Canadian websites, and the drugs had no efficacy or medicine in them at all. And so again, this is an area where there is, we have to be careful about consumer scams, preying on people to think they might be able to get low-cost drugs, which in fact are not drugs at all. But if we can get the real things here at the right price, all for it.
For Shelley Lenz, would you like to respond?
I think I stated my case.
Dwayne?
Same here.
Okay. And one more shot?
Nope, all good.
Okay. Then I have a question, and we'll start with Dwayne Hendrickson on this one. The Affordable Care Act has been really controversial. It's in front of courts again. Do you support or do you oppose the Affordable Care Act?
Since the Affordable Care Act was implemented by Barack Obama, I have constantly spoke out against it, and I oppose it 100%, and I hope that it gets repealed.
Governor Burgum?
I think that the whole debate about the Obamacare and the Affordable Care Act was misguided. we've spent now, what, a decade talking about insurance that covers a portion of the population. And we talk about eligibility for that insurance. We talk about all these things, but we never talk about we talk about making insurance affordable. We never talk about making healthcare affordable. We don't talk about how do we increase productivity in the healthcare sector to help lower costs. We don't talk about building healthier communities and focusing on all the holistic aspects of health that can reduce the cost of sick care. So there are certain aspects that are now part of the system, whether it's expanded Medicaid, which again has helped in North Dakota keep our hospitals to have less bad debt. There's elements there that were effectively have been built into the system that would be hard to remove. But if we're going to have this debate for another decade, let's talk about how we can build healthier communities, have a healthier population, and have better health care as opposed to just have the debate on insurance portion.
Shelley Lenz.
I 100% support the ACA, without which our rural hospitals will become insolvent. But because it's on the line at the federal level with a lawsuit that my opponent supports, I have also wanted to add, with my homegrown prosperities, North Dakota Care for all North Dakotas, where simply being a North Dakota resident gives you access to in a private-public option it will give you access to a private insurance buying group. The public input is the state getting that set up. The private part of that is it being a co-op model, which works so well in a rural environment. That will give North Dakota residents access, regardless of what happens to the federal level.
One more bite at the apple, Dwayne Hendrickson.
I believe that we could have cheaper health insurance rates in North Dakota if we would be allowed to purchase our health care from any state and any company that sells health insurance. I believe that when they limit our health care to purchase from in North Dakota, that we might be paying in excess for that feature. So I believe that they have to open up the borders and we can buy insurance from any state in the nation.
Doug Burgum.
Prior to becoming governor, I had an opportunity when I was in the IT sector to work with companies in healthcare. I saw firsthand what government regulation can do to destroy competitiveness and quality of service for citizens. We have a $20 trillion economy in the U.S. $4 trillion of that, or about 20%, is in healthcare. And that's twice the size of the Soviet Union economy in 1989. And if people think that we can somehow regulate a $4 trillion economy and have the federal government control it, we need to look no further than two areas of great frustration for customers, and that's been the VA healthcare system, and then I think even worse, the Indian healthcare system in terms of not taking care of the needs of our tribal members. Those are two federally run systems. And again, to try to move towards more federally run healthcare, I think is a wrong idea. I believe we can do things in North Dakota for North Dakotans that make sense. And if the federal government wants to do block grants to a state versus force people into the ACA, we can take care of rural hospitals and we can take care of North Dakotans, and we can do it cheaper and better than the federal government can.
And for Shelley Lenz.
In addition to the North Dakota Cares for all North Dakotans, I would also prioritize investing in community health, making our local public health officials have access to the resources and tools they need, along with the community health members like home care co-ops, our pharmacists. Our pharmacists are trained in much more than just the dispensing of drugs, and they can be partners at that local level where you're the most trusted member of the society, and that will relieve some of our pressure on our critical care access hospitals, as well as improve preventative care measures.
The next topic is the state budget and the legacy fund. Now, a recent survey of North Dakota voters conducted for economic development in North Dakota showed respondents favored investing the funds within the state, with a strong majority saying the fund should take an additional risk if it means investing in North Dakota economic development. There has also been some talk of an initiated measure to require that 100% of the legacy fund be invested in North Dakota. Is this a prudent path to take? We start with Doug Burgum.
Well, Lieutenant Governor Brent Sanford and I are all in favor of investing more in North Dakota. Thinking that we could invest 100% of the legacy fund in North Dakota only, I'd want to see the deal flow on that to make sure that North Dakotans are getting the right kind of returns, and that we're putting those investments into things that do provide returns for future generations. But as we take a look at return, we have to look at total return. What's the return on the investment, but what's the return on to the community in terms of sales tax? What's the return in terms of workforce retention? What's the other ancillary benefits that might come from other forms of state revenue? So I think there's real synergies of investing here, and it's one of the reasons why we supported the Theodore Roosevelt Presidential Library. Here's an example, a legacy project where we take $50 million. It doesn't even leave the state. It stays at the land board as an endowment if and only if we can raise $100 million of private capital as a minimum to match that. And so if there's ideas about how we can take the legacy fund and get 2-to-1 matches from the private sector, I'll be in the front of that line, because those are super high return on investment opportunities for every citizen in North Dakota.
For Shelley Lenz, then.
I stand with the majority of North Dakotan people that believe that that money should be invested locally and managed by local people. I think the earnings should be used for legacy initiatives like $50 million for a regional mid-sized meat practicing facility, which will actually generate new revenue. It will give food security to our state. It brings in other areas like higher ed in soil sciences and meat sciences. And the value added is not just meat, it's boots and belts. And it's, again, that public-private partnership, that $50 million investment by the U.S. or the North Dakota government, and then it's run by the best business model for a rural state, the North Dakota Beef Co-op. And that's how we keep the power in the people and the flexibility in business management.
Dwayne Hendrickson.
On the budget, I believe our legislators have to look at reducing spending, reducing frivolous spending, and using that money more to help each individual in North Dakota. As for the legacy fund, I believe that we should invest that money locally in North Dakota, but try to keep our hands out of it as much as possible. You know, I've talked about abolishing property taxes, and in order to recoup some of that $1 billion that we do collect in property taxes, I may have to use a legacy fund, but I don't want to use that much of it, because I believe that that legacy fund is an advantage for North Dakota, and we have to keep that advantage. But like I say, we collect $1 billion in property taxes, and the people can't afford that anymore. They want that money back in their pocket to improve their home, improve their lives.
Any rebuttal from Doug Burgum?
Well, I wouldn't say rebuttal, but just add on to that. When we take a look at the state finances right now, we know that during COVID we had facing a big downdraft with energy prices and ag prices. But with the fiscally conservative budgeting that we have done, and with tightening our belt the minute the pandemic started last spring, we're going to go into the end of this biennium with more money in our ending balance by more than $100 million than what we had projected. And again, we did shore up our balance sheet and heal that up after the rainy day fund had been depleted to zero during the 2016 crash. We've got that back up to a record $736 million. And so right now, our balance sheet is strong, our spending is conservative, and I'm confident with our forecast through September, 15 months through a 24-month biennium, we are ahead on revenues, and there's very few states in the country, having come through COVID this far, that are actually ahead on revenue. So fiscally, North Dakota is in great shape, and we look forward to working with the legislature to navigate even further through this situation.
For Shelley Lenz.
And I would also like to make sure that legacy money is being used for true legacies. Another example of an initiative would be a public-private partnership where we actually generate new revenue, help clean up some of our climate situation, where we actually invest in capturing that flare. And that's the initial investment by the North Dakota government. But then after that flare is captured, that will increase our gas plans. It will increase gases that we have for farmers. But it's run by the best business model for a rural state, the North Dakota Energy Co-op. That's how we generate more money and stay flexible through good times and bad while we boom and bust through our energy, and we evolve our energy systems into the future. Energy and food will always come from a rural environment.
And for Dwayne Hendrickson.
As we move forward in this COVID battle, we have to make investments in our communities, many investments, and we have to change the business model of those that we are investing in, because, like I say, COVID has changed the way that America operates, and we're going to need much more technology to keep America safe and supplied, and Americans healthy and safe.
As a follow-up question, and we'll start with Shelley Lenz on this one, the so-called prairie dog bill probably will not be funded in the upcoming 2-year period because of the downturn in the oil industry. Do you support using some of the Legacy Fund proceeds for that infrastructure plan, or would you find other sources?
I think that infrastructure is a legacy, but our markets are commodities. We need to make sure that we can get our products to market. So we need to have safe roads, longer lasting roads, and continue to get our projects to the market. So yes, that is a good use of the Legacy Fund.
Dwayne Hendrickson.
Our infrastructure needs to be funded. I don't know if it necessarily needs to be funded through the Legacy Fund, but we have to make sure that our oil and gas pipelines are operational at all times. That's shipping stuff to market. We have to make sure that we have safe rail for our trains to travel on. And those things are wise, positive investments for our nation, not just North Dakota. We have to keep moving forward, and if we quit shipping oil, we can hardly move at all. You know, how many things are made from oil today, and you know, if we lose the transportation mode, how much of that product will we be losing? So we have to make an investment in every community.
And Doug Burgum.
Well, we've been investing significantly in infrastructure the last 4 years, but there's still many opportunities to do this, whether that's road, bridges, water infrastructure, or new innovative infrastructure. The legislature last go-round, with great vision, put in $28 million to build the first statewide unmanned aerial system, air traffic control system. This has brought all kinds of capital and businesses, from some of the top aerospace companies to some of the most exciting startups, to North Dakota, because for the first time anywhere, you'll be able to fly beyond visual line of sight and do testing for unmanned aerial systems. These are going to help with applications for pipeline safety, for energy development, for the environment, and for agriculture. And so there's all kinds of exciting ways to invest in infrastructure, and we should be thinking boldly about that, particularly at times now when interest rates are at historic lows and when a workforce is available. This is the time for us to be building out infrastructure in North Dakota.
Shelley Lenz, would you like another shot?
Again, energy and ag will always come from rural states. They are our main revenue producers. We need to make sure we're investing in the roads and the transportation to get our products to market, and we can get to work as well, safely and without undue property taxes.
Dwayne Hendrickson, your shot?
I'll pass.
Okay. And Doug Burgum.
Well, another key piece of infrastructure in our state is the infrastructure that builds resiliency in communities, and specifically making sure that we've got access to water and we've got access to flood protection. The state has invested significantly in communities across the state, but particularly in Minot after the historic floods of 2011, and in Fargo. Our administration worked with the governor of Minnesota, reaching across both the river and the Isle to get the diversion project back on track, which is going to protect over $24 billion of property, over 60 K-12 buildings, an entire university, and about 20% of the healthcare capacity in the state. And so again, these kinds of projects supported by the North Dakota legislature are key for us to continue to have vibrant, resilient communities going forward. And on water supply, whether it's the Red River Water Supply, Southwest, NAWS in Minot, or WAS in the Williston-Watford area, those have been critical to supporting the energy industry and in agriculture. We'll continue to fight for resources for all of those.
A little follow-up on the budget next, and I'd like to start with Dwayne Hendrickson. If you have to reduce the state budget, where would you do that? And what should be a priority for state spending?
Well, I believe that a report just come out that said our revenue was ahead of expectations, so we shouldn't have to cut the budget. But if we do, I believe that the highway department would maybe be one of those that we have to cut. But if we cut from there, we just have to add it to different parts of the budget to take care of what's happening with this COVID deal.
Doug Burgum.
Well, as Dwayne just said, because we are running ahead, we look like we're going to be in pretty good shape through the biennium that ends June 30th next 2021, with just the belt tightening we're doing right now. As we start planning for 21 to 23, that 24-month period, we have to always be looking for ways where we can deliver government services cheaper, faster, and more efficiently. And one thing certainly COVID has shown us is that, for example, we probably don't need the 24 million square feet that the state either owns or leases across the state of North Dakota, because we were able to operate government. We had to send over 7,000 state team members home in a 48-hour period, but thankfully, because of the investments by the legislature and our great IT team, we were able to have people work remotely. But I think there's many opportunities and many more that a light was shown on them for us to actually reduce cost and improve the delivery of services. And so I'm confident that even though the revenue picture looks good, that we can continue to take cost out of the budget with not only hurting services, we could actually help services be more efficient, 7 by 24 hour, give taxpayers the same kind of customer experience they get from anybody else, where you can interface with them 7 days a week, 24 hours a day, not 9 to 5 at a government office you have to drive to.
Shelley Lenz.
The governor had 4 years to reinvent government and balance the budget. He really just passed the buck to local leaders, so that the property taxes now are 9% in Cavalier and Walla, so that they can produce a water tower. That's not a balanced budget. That's just passing the buck. We need to increase our revenue because we will have a budget shortfall. To do that, we need to ensure that we are getting what we are owed. Don't cut services first, but first get what we are owed. Second, instead of making these broad 10% cuts across the board, we need to take a surgical approach to the state agencies. And lastly, we need to know who is paying their fair share and who is not.
One more bite at the apple, Dwayne.
We have so many things to do for the citizens of North Dakota, for the communities of North Dakota, and I'll work with the legislators to trim the budget where we can, add that part of the budget to the budgets that really need that money, and make North Dakota progress. We have to take care of our citizens. This is a government by and for the people. We have to start making it by and for the people.
Doug Burgum, second.
Well, in terms of water projects, the State Water Commission, again with the support of the legislature, has invested hundreds of millions of dollars in local projects, whether rural water, local water towers, local flood protection across the state. And as far as the property taxes, with the work that was done as part of reinventing how county social services was taken over by the state, that created over $178 million of permanent property tax relief for the citizens in North Dakota. And from a we said 4 years ago we're going to put in a new strategic planning process. We're going to change the culture, so it wasn't about if you had a bigger budget you were a winner and a smaller budget you were a loser. It was about if you had better outcomes for citizens you were a winner. And with that strategic planning process, 2 times now over the both budgeting cycles, we've held strategic planning meetings with over 57 agencies each of those 2 cycles. In the first round, we cut over $100 million out of the state budget, and nobody missed a thing because we eliminated a bunch of mindless work that nobody needed to be doing in government, and it was just pure savings for the citizens of North Dakota. And we'll keep doing that with the processes that we put in place to improve how we do strategic planning and budgeting.
And Shelley Lenz, your shot.
Well, the fact is that school measures are not passing anymore due to the continued property tax increases. It's October, and our children are still not able to safely attend school. They don't have the resources they need to give the basic government responsibilities. It's time that we start investing and ensuring that everybody's paying their fair share, but our schools and our counties have the resources and tools they need to make sure that our next generation is as healthy and wise as our past generation.
I'm going to ask a follow-up question. I'd like to start with Doug Burgum on this one. Is the state too dependent on the oil industry for its revenues?
Well, we're very fortunate to have a robust energy industry in our state, and we should be grateful every day for the work that they've done, the prosperity they've brought, not just to the western part of the state, but to the entire state. During our time in their administration, there's been over $20 billion invested in North Dakota in new gas plants and new oil wells and new gas gathering, new infrastructure that's been put into the western part of the state. The taxes from that flow back to those communities and those counties. It also flows to the state, and it creates a major portion of support for a number of entities, including the K-12 system statewide. We are now, talk about relieving property tax values in the state. The state of North Dakota 10 years ago was paying 25% of local K-12 expenditures. Now the state pays 75% of the local K-12. The first time in the history of the state where now over $10,000 per student are being delivered to those local school districts from the state, and that is being driven largely by the success of the oil industry.
Shelley Lenz.
The fact is that 53% of the state revenues came from oil. That's not diversifying our economy. The other fact is we lost energy jobs and the small businesses that service the energy industry from the COVID, but also from the oil price wars. We are in competition with 28 other states for the electricity market, and we have failed to evolve the industry to continue to be competitive. We have a coal plant closing in Beulah. That is going to affect a whole community's rural health system. We have become way too dependent on one source of income, and he didn't get the job done in the 4 years that when the sun was shining. And now he doesn't have the grit to do it.
Dwayne Hendrickson.
Our coal plant is actually going to shut down in Underwood, Coal Creek Power Plant. But we collect $1 billion every year in property taxes. $700 million of that goes to the public school system. So we have to start using the School Lands Trust Fund that has $5 billion in it to start paying that $700 million that goes to education, all of our property taxes, and so that we can eliminate property taxes. That makes it much easier if the School Lands Trust Fund starts paying for the education that they're supposed to. And lost my train of thought.
Okay, we're getting close to the end of the debate. I wanted to get to this one, and it relates to what you all were talking about just now. North Dakota has been promoting an all-of-the-above energy strategy, which includes renewables, oil, and coal. With the impending closure of Coal Creek Station, should the state be making investments to keep that plant open? I'd like to start with Dwayne Hendrickson on that.
When I heard that Coal Creek was going to close, that was the first thing I thought of was does the state have the money to invest in that? And then do we have to buy the electrical transmission lines that go with that? And that's something that I haven't been able to answer and haven't got answers for it. But we have to maintain all of our energy industries, but I'm not a fan of windmills, we see so many reports about them, and we believe that it adds cost to our energy, and we don't believe that it's environmentally sound from the production until the end of their life. And so we have to look at positive things in the energy industry, and I don't believe that putting these windmills all over our beautiful landscape is a positive thing for our state.
For Doug Burgum.
Well, we're committed to an all-of-the-above energy strategy in North Dakota, and we've seen tremendous diversification with all kinds of investments in wind energy in our state, many of that driven by federal production tax credits. Coal Creek, Lieutenant Governor Brent Sanford is working 7 days a week with industry to save this plant. It's critical not only for North Dakota and for the communities around Coal Creek, but it's also critical for the nation for us to have resilient baseload electricity. We can't be running our nation just on renewables. We saw this during the California this fall during the fires, where they were having rolling brownouts. They've had power outages. They were buying and trying to trade electricity from other sources. So as a nation, it's important for us for energy security that we maintain baseload. We have opportunities, in addition to wind, to produce with the extra gas we have, to have ethane-powered electricity plants in North Dakota. And we're confident that there's going to be a private sector solution that will emerge that will help benefit this. And to help support that, we continue to invest in R&D. $16 million from the state into Project Tundra for carbon sequestration to allow us to produce a clean coal product. That's leveraged over $40 million of additional R&D and $70 million from federal partners.
Shelley Lenz.
Under Burgum's administration, we are caught flat-footed, and now we have a community at risk. My platform of homegrown prosperity is to stabilize those energy booms and busts. So I do believe that the coal plant has in addition to producing electricity, there's so much in coal that can be extracted and revenue generating. Or potentially we invest in carbon capture there. But we also need to invest in capturing that flare. And so we will look at the most efficient way to save those jobs and save those communities so that we can prosper together.
We have come now to our closing statements. Each candidate will have 1 minute, and by draw, we start with Dwayne Hendrickson.
For everybody sitting out there watching this debate, I am not a politician. I'm looking from the outside in, and I see things that we should be able to change, and I believe that we, the people, as part of my administration, will agree with what I see as a positive change for North Dakota, agree with me, and I hope that they will consider electing me as the governor of North Dakota to advance our state in progressive ways.
For Doug Burgum.
North Dakota's future is so bright. Our potential as a state remains unlimited. And despite the current challenges we face, let's understand the pandemic is actually making us stronger and more resilient. It's solidifying and elevating our understanding that we, as humanity, are truly all in this together. It causes us to remember what's great about America and the freedoms we cherish. And it reminds us of the spirit of North Dakota that we all hold dear, a spirit that was built around optimism that fuels perseverance despite hardships, a strong self-reliance, and neighbors helping neighbors. The pandemic is challenging us to improve everything from healthcare to education and rethink our systems from supporting our elders and most vulnerable. It's creating a huge opportunity for us to transform higher education and lifelong learning and technical education. This moment in history requires innovative leaders who know how to reinvent government, balance the budget without raising taxes, and strengthen and diversify the economy. We ask for your support and your vote. Thank you, and God bless the great state of North Dakota.
And for Shelley Lenz.
Doug Burgum didn't get the job done in anything he brags about. He didn't diversify our economies, He didn't reinvent government and actually fractured his relationship with his own party's legislature. He didn't solve DAPL, and he didn't save energy jobs. And our property taxes continue to increase. The governor put politics over people in the COVID crisis. Look, he didn't make hay when the sun shone, and he definitely doesn't have the grit to lead us through the hard times. Over the decades, I have proven that I can bring stability and community resilience by focusing on working families, building financial independence, and public trust. I have done this in Western North Dakota and around the world through my vision and commitment to homegrown prosperity. I have come up with a COVID plan that I will implement on day one to lead us out of this triple crisis. My leadership is based on collaboration and listening to solve complex problems. Yes, the buck stops with the governor, and I will be the team captain, the first amongst equals. Sorry.
Thank you all very much. I'd like to thank the three candidates for governor for being here tonight. Thank you to AARP North Dakota for co-sponsoring this debate. I'm Dave Thompson. Thanks for watching, and remember to vote.
Funding for Election 2020 coverage is provided in part by AARP, a nonprofit, nonpartisan membership association, 86,000 strong in North Dakota. AARP encourages you to vote absentee or vote safely in person and make your voice heard. And by the members of Prairie Public.